Hi, everyone. Thanks for joining us today. I'm Terry Henning, CEO of the Pennsylvania Homecare Association. PHA is a statewide membership association with more than 700 member agencies providing home health, home care, and hospice services across Pennsylvania. We are excited to have the opportunity to talk with you today about the critical funding and other needs of home care providers who serve hundreds of thousands of older Pennsylvanians, individuals with disabilities, people recovering from surgery or injuries, medically fragile children, and more in the safety and comfort of their own homes. Today, PHA and our members are concluding almost 2 weeks of advocacy days. Since last Tuesday, more than 180 PHA members and staff participated in 145 meetings with 155 legislators. Hundreds of our members also had the opportunity to connect with legislative leaders, including the appropriations chairs, participate in a town hall with the Department of Health Secretary Beam, and meet with the governor's staff. In our meetings, we emphasize the need for increased funding and reimbursement rates for personal assistance services and pediatric shift nursing, the critical workforce shortages that home-based care providers are facing, the need to extend certain COVID-related flexibilities, and the importance of an Older Adult Protective Services Act that both protects seniors and preserves access to quality care. We want to thank all of the legislators and staffers who gave us their time, the governor's staff, Secretary Beam, and other stakeholders who have connected with us on these very important issues. We also want to let them know that they'll be hearing a lot more from us in the coming days and weeks as decisions are made about next year's budget and on additional funding for home and community-based services. We have a great group of speakers who are joining us today, some live and some by video recording. We want to start, though, by sharing a brief video that shows real caregivers and consumers to give you a small sense of what home care workers do in homes and communities across the Commonwealth.
Makes us laugh.
Yeah,
we're doing it.
yeah.
I'm gonna have a day one this week.
Thank you, sweetie. Thank you very much. Thank you.
All right, I'll see ya. Good job.
And you were a good girl.
How well do you do standing on your own?
Not too well, I don't think.
That's why I'm here to help you, huh?
I was lucky enough to be there for some of the home visits in that video, and it is nothing short of amazing to see the care that direct care workers provide, the difficulty of some of the work that they do, and the incredible relationships they've formed with their patients and consumers. Many of us have experienced home health, home care, or hospice in our lives. Some of us have had experiences with all three. We all want our family members and loved ones to receive the highest quality care in the safest, most comfortable setting, and for most, that is in their homes. If you haven't been personally involved in home-based care, you probably will at some time in the future. It is so important that we fund and structure this system to ensure that when you, I, or anyone needs a caregiver, they can find quality care in a timely manner. It's hard to put a dollar value on the importance of the person who washes the hair of your loved one when they cannot do it themselves, or the person who helps to restore the dignity that goes along with a clean body or eating a hot meal. For everyone who works or lives with home care, it's personal. But the facts are clear. Providers cannot recruit and retain enough quality caregivers at current reimbursement rates. That's true for both personal assistance services, where reimbursement rates range from about $18 to $20 an hour, which has to cover not only worker wages, but also insurance, taxes, overtime, transportation, PPE, background checks, and other expenses. And in pediatric shift nursing, where reimbursement rates have only been increased twice in 28 years, resulting in a massive wage gap between facility-based nurses and home health care. Home care not only results in better outcomes, it's also less than half the cost of nursing home care. We must fund and support it properly. I want to turn it over to our next speaker, who's joining us by video recording. We're so appreciative of the two individuals who are currently receiving services who are joining us today. Marcy Renneberg, who receives services from Angels on Call, and Joshua Rainsborough, whose son receives services from Bayata Home Health. Marcy is a longtime client of Angels on Call in the New York area, and I learned last night that she still texts the vice president of the agency every Christmas. Marcy's remarks have been edited slightly for time.
Hello, my name is Marcy Renneberg. I've had AIDS for approximately 7 years. And it is really very, very important to not only have health or AIDS to help, but they have to really be the right one to fit each person. Everyone's different. Every need is different. But my AIDS, basically, I'm to the point right now, I'm trying to improve and get better. Is, you know, like they get up and when I get up in the morning, make my breakfast, get my bath, clean and do all the things that I'm not able to do, go out to the store, take me out when we can for rides and things. All these things are very important, and it is very important, and I greatly do appreciate the fact that there are services like this. It needs to stay, though, each person, a human life, needs to be able to not only have quality of life, but be able to be as independent as they are able, considering their health situation. By my AIDS helping me, I can feel a little more independent. That's the best way I can put it. I myself want to do everything myself, so that's why it's a little harder for me to kind of get into that, but they do. If it wasn't for them, well, I don't know. I'm a fighter, and I fight to keep going and moving, even when I can hardly do it. But without AIDS, you know, handicapped, disabled person is basically, you know, probably going to die because they're not able to get to the things they need to do. Most of us that are disabled and all, we didn't know what was going to happen to us, and nobody knows. So to have a service like this is extremely important. I am extremely grateful. I must add, though, that it's a careful, you know, balance needs to be with, you know, like my manager here through Angels on Call really tries, but it's very hard if people come in. You can't just automatically know, are these people made to do this? It's a special kind of person that to be an aid is going to help. They can make or break a client, and it goes both ways. But coming from the client side, they really need to be people that are truly compassionate, truly want to do it, not just for a job. It's to help a human being, and that is, and yes, it can be tough, you know, it's a lot of work, but they have to really be wanting to do that. Because I've had both sides, and believe me, it's like night and day. When you have one that will help you and wants to and really cares, and also when you have one that doesn't, it's devastating, really. And I always try to treat people the way I want to be treated, so it goes both ways. The clients and caregivers must work together in a coordinated way, like, you know, taking treating each other right and things like that. It really is a much needed and sort of, there's always talk about short staffing. So it's always short staff, which doesn't help any of the people. And I don't know, because no one can make anyone want to do that, but hoping that there will be more people stepping up and try, to want to help those that are less fortunate like us, and to help us have some kind of quality of life. Because I have no family or anything, and relatives, I never knew what that was, to have that, and it is very important. And so the caregivers, they can give a much needed, companionship, and just give them some kind of quality of life sometimes, get close to each other, almost like a family, which that's a wonderful thing too. And I appreciate you giving me the chance to do this, to speak like this. And I hope everyone has a great day. Thank you.
Good afternoon, everyone. My name is Dave Totaro, and I'm the Chief Government Affairs Officer at Bayata Home Healthcare. Bayata is proud to be a top 40 employer in Pennsylvania, where we employ more than 10,000 of the state's professional caregivers, and who enable more than 15,000 children, disabled adults, and seniors across the state stay safe at home together with their families and loved ones. Staying safe at home has taken on a new meaning in the past year. For many of us, it has meant increasing our personal awareness to keep ourselves and our more medically vulnerable loved ones safe. It has meant limiting our outings to what's necessary. But for tens of thousands of families that need nursing care, it has meant much more than that. It means that one change in their care could lead to an infection or a medical emergency. It means that their critical and ever precarious home nursing care is at more risk than ever before. It means that their nurse, who has long known that he or she can earn more by working in a facility, has now decided to make that change so that they can better provide for their own family. And that means yet another family must sacrifice even more to make sure that their loved one can stay at home rather than be in a hospital or a nursing home. We're proud of the work that we're doing to ensure that thousands of Pennsylvanians that wish to stay safe and independent within their communities are able to do so. But like many others within our industry, we are facing a major employment crisis. This crisis stems from our inability to recruit and retain a qualified workforce. Home health care providers are unable to compete with other care settings and other institutions that can pay more in wages, particularly due to state Medicaid reimbursement rates that remain inadequately funded. Bayata and other providers across the Commonwealth rely on these state-funded reimbursement rates to not only pay our staff wages, but also to provide them with things such as benefits, training, supplies, supervision, even transportation. As these rates continue to lag, and we continue to be unable to compete with other settings and other industries, we have found ourselves severely limited in our ability to recruit and retain qualified workforce necessary to keep up with the growing number of individuals who just want to be cared for at home. We're hearing alarming reports from our families and our offices about how COVID has made this already dire situation even worse. Nurses are being recruited to make 3 times more per hour giving vaccinations. They are leaving home care or even health care altogether because wages aren't rising fast enough to meet the increased challenges they are facing being just nurses during a pandemic. You know, Pennsylvania is one of the only states that Bayata serves that has not given any emergency federal funding towards pediatric home care. Today, amid an ongoing pandemic, nurses are continuing to bleed out of our industry that has already been facing crippling workforce issues. As a result, NICUs across the state are unable to discharge babies because there aren't enough nurses available to bring them home. Families are desperate and have reached the end of their line. What will happen when there are no more nurses available to take care of children at home? What would happen to your child? Would you be willing to put them in a full-time facility or even in a nursing home? On behalf of our Bayata clients and nurses, and on behalf of all the families and nurses across Pennsylvania that struggle every day due to low state funding for pediatric home care nursing, I have one message for our lawmakers. In the coming week, as you make decisions that affect our youngest and most medically fragile Pennsylvanians, I urge you to support them by investing more funding in pediatric home care nursing. We are seeking a $10 per hour increase to the pediatric shift nursing reimbursement rate. In a few minutes following me, you'll be hearing from Joshua Rainsborough. Josh is the father of 12-year-old Henry, who has a traumatic brain injury and requires around-the-clock nursing care. Home nursing care has given Henry the opportunity to continue to attend school, to socialize, and recover at home in an environment that is familiar to him. Josh and his family are just one example of many across the Commonwealth that have taken incredible measures to make sure their child is safe and is not subject to institutional care. I urge you to pay attention to his story and consider it when you make decisions that affect Henry's health care and that of thousands of other children across our state. Now is the time to act. Pennsylvania will undoubtedly need qualified workers to provide the necessary care for these individuals. And I'm asking you today to ensure that care is available and accessible for everyone who needs it most. The advantages of keeping Pennsylvanians in their homes and in their communities are really well known to our lawmakers. We keep vulnerable children, adults, and seniors out of hospitals and nursing homes. But now it means much more than ever before. So please, please support our Pennsylvania families by investing in pediatric home nursing care. Thank you.
Good afternoon. My name is Joshua Rainsborough, and this is our son Henry, who is taking a little bit of a cat nap. I'd like to take some time to share our family's experience with home nursing care. In 2016, Henry, his friend Danny, and I were in a horrible automobile accident that caused severe injuries for all of us. Henry was diagnosed with a traumatic brain injury as a result, and of course our lives have been forever changed. Our son requires total around-the-clock care, and if it wasn't for Bayata Pediatrics, their nurses, and the in-home support that they provide, Henry's recovery would certainly be severely curtailed. Henry will be 13 in September, thanks to the medical community and Bayata Pediatrics. We are one of the many families across this Commonwealth who rely on private duty nursing to keep our family together. Our nurses provide peace of mind that Henry receives the same care that we as his parents would give him, while providing my wife and myself with much needed respite from our caregiving responsibilities. Bayata nurses allow Henry to go to school with his peers, where he is able to engage with social interaction, learning, and receive school-based therapies. Like all children with disabilities, Henry thrives at home, surrounded by the people he loves, and we love him just as fiercely. Henry's Bayata nurses have become a part of our family, each bringing their own personalities, but the same level of compassion, excellence of care, and reliability. His nurses love Henry just like he was their own child, always placing his needs first. One of the challenges we, like other families relying on in-home nursing face, is staffing, of course. There are times when the nurses need a day off or they must call off for a number of reasons. And today is a perfect example. Our nurse called off, and so when that happens, my wife or I become Henry's nurse for that shift. And it's very rare to find a substitute since all of the other staff that could be substitutes are caring for other children. And of course, then that means my wife or I will inevitably miss work. And Henry, I would say more importantly, Henry will miss school, therapy, or even a doctor's appointment. The shortage of nurses has posed a continual challenge as we have worked to secure and maintain overnight nursing for Henry's care. It really goes without saying that compensation is often greater with other agencies like hospitals or private medical offices. The bottom line when it comes to private duty nursing care is funding. Our primary health coverage, like most insurance companies, does not cover this much needed expense. In-home care in Pennsylvania is significantly less expensive than the mid-Atlantic regions of states of New York and New Jersey, and slightly less than Maryland, but certainly is more expensive than Ohio. Without your support and adequate funding, kiddos like Henry won't be able to stay at home with their families. This shouldn't be a privilege. Pennsylvania has realized only 2 increases in Medicaid reimbursement since 1993. Healthcare workers like those who care for Henry are deserving of a much overdue raise. In-home nurses are not replaceable commodities, but rather priceless assets. They deserve to be compensated a fair and a just wage. The basic care of one child comes with a myriad of necessary behind-the-scenes expenses for agencies like Bayata. They include things like finance, operations, technology, recruitment, retention, sales and marketing, awareness of industry trends. And all of these things culminate in client caregiver health and satisfaction, or lack thereof. Increased monetary support is not just important, it's necessary. Financial support allows children like Henry to be at home with his family rather than residing in a long-term care facility. Keeping families together in their homes will ultimately save the Commonwealth from the expense of institutional care. In addition, parents and caregivers are able to continue working to provide for their families. Henry was not expected to ever make it out of the pediatric intensive care unit. I firmly believe that Henry would not be where he is today as much as he's progressed with his healing if it weren't for the fact that he's home with his family. I can't even imagine what it would be like without access to the care that our son Henry receives. At the end of the day, families like ours rely on the Commonwealth's decision makers, all of you, to support home nursing care because it keeps us together at home. We all deserve that. I want to take a moment to thank you for your time and your consideration today. He's still sleeping. Thank you. Thank you very much.
Good afternoon, everyone. My name is Lisa Giovanni. I am the president of the Visiting Nurse Association of St. Luke's Home Health and Hospice in Bethlehem, Pennsylvania, and I am also the president of the Pennsylvania Homecare Association Board of Directors. I would like to thank and recognize all of the participants in PHA's 2021 Advocacy Days. Your collaboration has supported 2 weeks of interactive meetings with members, legislators, the administration, and other stakeholders. We have had the opportunity to connect with so many individuals in a way that may not have been possible if we were in person. We are so appreciative of the level of support that we have heard for protecting and preserving quality home care and community-based care. During the last 10 days, we have particularly focused on 3 key asks and issues: an 8% increase of the Medicare reimbursement rate for personal care assistance services, a $10 an hour wage increase for pediatric shift nursing, the permanent continuation of valuable COVID-19 flexibilities that impact the efficiency and the quality of care, and revisions to the older Adult Protective Services Act that both protect seniors and support access to quality care. And while PHA and our members are grateful for the commitment from many to support these vital requests, along with the recognition of the critical role of home-based care, I want to spend the last few minutes today focusing on the needs for both words of support and action. The past year shined the light on the reality that home care has come home. In our homes, we are safer, healthier, and more likely to heal and become stronger. Home-based care is not only the place that people want to age and get better, but it is also less than half the cost of nursing home care. In light of all that Pennsylvanians and the world have experienced over the past 18 months, we can't emphasize enough that now is the time to prioritize home care for Pennsylvania's most vulnerable citizens. It is time to act, and it is time to make long-needed changes. Our industry is at a precipice like never before, with individuals' lives and access to quality of care in the balance. We invite legislators, the public, the media, and anyone else who is interested to learn about the issues and the people who are affected every day by home-based care to reach out to PHA and to our members, to use us as a resource in understanding the needs and the work necessary to solve the many challenges that lie ahead. We often hear about funding challenges, and some say that we can't afford to make major structural changes in light of the fiscal issues that are facing Pennsylvania. But the truth is, we cannot afford to not act. With $7 billion in federal funding available to Pennsylvania and an additional $730 million that must be targeted for home and community-based services, we have never had a better opportunity. We've never had a better opportunity to support home care in a way that ensures quality, cost-effective, and sustainable care. And in order to show that support, we must continue to advocate for and to secure funding. Recruiting and retaining quality caregivers before COVID-19 was difficult, and now we are at a crisis point. As expenses continue to rise for insurance, overtime, PPE, background checks, overhead, and more, and while reimbursement rates have remained too low, home-based providers are increasingly unable to pay competitive wages that recognize the essential high-value work that their caregivers provide. Without increased funding to support higher wages, we are putting at risk hundreds of thousands of Pennsylvanians who need personal, skilled, and end-of-life care where they want it the most, in their homes. PHA calls on our members and their caregivers across the state to continue to join in discussions with legislators, the administration, and other stakeholders in the coming weeks and months. We hope that others will join us in highlighting and elevating the critical needs of our consumers and our patients that receive care in their home. The resources, the desire, and the commitment to act, and the urgent need of those receiving care all reinforce that we must take critical steps now to fund and support home care. Solutions are within our grasp in a way that they never have been before. And while we continue to work to achieve this funding and support, please know that caregivers at PHA's more than 700 provider agencies across the state, along with other home care providers in Pennsylvania, will continue to care for our children, our parents, our grandparents, safely in their homes. We are asking decision makers to step up today and in the weeks and months ahead to prioritize home-based care because it is the care that we want for our loved ones, for ourselves, and because it saves money for the Commonwealth, and because it's the right thing to do. Make home care, health care at home, the highest priority for Pennsylvania by better funding and supporting care at home. Thank you so much for joining us today and for your support as we rise to meet all of the challenges in 2021 and beyond.
Thank you. Thank you to Marcy, Joshua, Henry, Dave, and Lisa. We also want to thank all home-based care providers in Pennsylvania for their time and commitment to their patients, consumers, and caregivers, for their efforts over the last 2 weeks, and most importantly, for all they've done over the last 18 months to keep people safe and healthy in their homes. Home is where people want to age, heal, and receive care. It is cost-effective with better outcomes. With the $7 billion in federal funding, plus an additional $730 million that can only be used for home and community-based care, the time is now. We urge legislators and the administration to prioritize investment in home and community-based services so that Pennsylvanians can continue to have the choice to receive quality care in the safety and comfort of their own homes. If you have any questions or would like additional information, please contact any of us. Our contact is on the slide. We'd love to talk more about how to fund and support keeping more Pennsylvanians safe at home. Thank you.